Hey guys, Tony Maritato here. So when we're talking about elevation, right, and we're talking about post-surgical knee, we want to elevate specifically to reduce swelling. Elevation is not sitting back on the couch and propping your leg up on an ottoman. Elevation isn't laying back in a recliner. Elevation is getting the knee, the whole leg really, at least to about 35 or 40 degrees at the hip, if not higher. So I understand it's challenging to find places in your house to do this. The easiest place is on your couch. If you're able to recline or lay flat on your back, what I usually recommend, so here's my couch. Let's pretend this is my left. I had a total knee replacement on my left. It's swollen, it's hot, it's uncomfortable. I want to work on elevating to reduce swelling. So what I would do, I'd sit on the couch, I'd pivot, I'd get that leg up on the armrest of the couch, and I'd relax. From a comfort position, if it's too uncomfortable to be further back with the knee in full unsupported extension, you can slide down and at least get it, supported somewhere around the mid-calf. If you can tolerate this position pretty well, then what I'm gonna do is I'm gonna say, let's elevate higher, going to the back of the couch. So I come here, I rotate a little bit, and so now I've got that leg up. Get this one out of the way so you can see. When I say 45 degrees, even 90 degrees, this is what I'm talking about. From my body being 0 to where my leg is, we want to get it to minimum 30 degrees, preferably 45, as close to 90 as you're comfortable. And so if I could just stay in this position 10 to 15 minutes, that's kind of the ideal amount of time. And then if you want to check if there's any improvement, you would take a tape measure around the girth, the width of the knee, the circumference. You would do it before you get into this position, and then you do it again after. Certainly you can work your ankle pump, certainly you can work your knee extension, you can read a book, you can play on your phone, you can watch TV, whatever it is that you feel like you want to do just to pass the time. One other thing that we can do is from this position, we can work on tightening that quad, pulling the toe back, but we can also kind of let the other leg down just to help stabilize the pelvis if you're getting some low back discomfort. So let me know how it goes. Spend 10 to 15 minutes in that elevated position. Maybe later in the day when the swelling tends to increase because gravity has been pulling that fluid down throughout the morning, mid-afternoon, late in the day, the evening, you get that leg up, 10 to 15 minutes. Let me know if you find that the girth of that mid-knee is reduced after 10 to 15 minutes of elevation. In the next video, I'll show you how to use the rolling pin to help improve some of that lymphatic drainage and getting some of those waste products out of the tissue as it's healing. All right, guys, I'll catch you next time.